Today we're going to look at how to add to existing dentures. This is known as the term addition and is the process of adding one or more artificial teeth, or it could be retentive clasps, to an existing denture.
We've received the alginate impression from the clinic. Inside the alginate impression is the existing partial lower denture. We rinse the impression under cold running water to remove any debris and prepare a mixture of plaster of Paris. We take the plaster of Paris mix to the vibrating table and using a model base former we transfer some of the plaster into it. Then, taking a small amount of plaster, we place the impression on the vibrating table, where small amounts of plaster vibrate down into the two remaining teeth. Subsequently, more plaster is transferred into the fitting surface of the lower denture. We build this up until it just covers the edges, and then invert the impression over onto the plaster that is held in the base former. Once the two are together, we use the knife to remove any excess plaster. At this point, transfer the model to the plaster trimmer, and using the water-driven wheel we trim away the excess plaster from the sides. When this is complete, we use a plaster knife to remove any excess plaster from the side walls in order to free the denture edges. This will leave the denture in a state in which it can be removed without damage. We now return to the workbench with the acrylic denture. Before you go any further, it's essential that we check the prescription to ensure it's correct. It's important at this stage to match the shade of the tooth with that of the acrylic denture, since shade information is not always included with the prescription. Using a plaster knife, we carefully ease the denture away from the plaster model. In this instance, the tips of the two teeth have broken off. This is not important at this stage, as the teeth are being removed from the model anyway. Use a pencil to mark the gingival margins of the natural teeth on the model. Again, using a plaster knife, we sculpt and remove the remainder of the plaster teeth away from the model at the pencil marks, before rounding off these edges to leave a nice, smooth edge to the arch. Next, we use a carbide burr to prepare the denture to accept the new teeth. Cutting in on either side of the space to be added to, we place the denture onto the plaster model and add some base plate wax into the space. We position the selected teeth on the softened wax, using the arch shape of the existing denture to set the arch width. Use the incisor ledge of the abutment tooth and the cuspal tip of the other abutment tooth as a guide to the incisor level for the placement of the teeth. Once we're happy with the position of the teeth, we continue to contour the wax and shape it to resemble the gum work. Taking a mix of laboratory putty, we can adapt the silicone impression to the labial buccal face of the waxed up teeth and denture at the abutment teeth, while slightly covering the incisal level and allowing the material to set. Once the lab putty matrix is set, we move over to the boiling out tank, where using a lecron we remove the putty matrix and trim off any excess edges. Removing the acrylic denture from the plaster model, we extract the two artificial teeth from the wax and place them into a mesh holder. This is placed into the boiling out tank along with the lab putty matrix, the denture and the plaster model. Then we use the hot spray to remove all traces of wax from all four items. When all traces of excess wax have been removed, we apply a separating medium, in this case sodium alginate. Taking our artificial teeth, we place them into the lab putty matrix and place the acrylic denture onto the stone model. With everything in place, we prepare a mixture of self-cure acrylic resin, mixing the monomer and polymer until it has a slightly runny consistency. We run the resin down into the space vacated by the wax, ensuring that it flows over the arch and down into the anterior flange and around the artificial teeth. Once the acrylic is in place, we place the items into a pressure pot filled with water heated to a temperature of 40 degrees. The combination of pressure and warm water will initiate the chemical reaction in the acrylic and prevent any porosity within the mix. It should be left to cure for at least 10 minutes. When the curing process is complete, we can unscrew the pressure vessel and remove the completed addition from the warm water within. Removing the putty from the assembly, we can see the resulting pink flange with white acrylic replacement teeth in position. You will notice a rough edge of acrylic or flash on the lingual side of the finished item. This can be removed using a variety of abrasive burrs, starting with a tungsten carbide cutter in a high-speed handpiece. We carefully remove the excess acrylic and then use finer and finer burrs, including a rosehead burr in the fitting surface if there are any potentially uncomfortable edges. We might also use a flexi wheel in order to get into the interdental spaces between the teeth. Once done, we're ready for the final polish over at the polishing lathe. To carry out the final smoothing for the addition, we use pumice and water as slurry. Again, we start off with the largest and most abrasive wheel head and graduate down through finer and finer fittings. To complete the final polish, we use the woolly cotton mop rubbed with the polishing block. The polishing block consists of fine pumice mixed with a wax resin. We spread our fingers behind the denture to distribute the pressure as we move it around in all directions. Once complete, all we need to do is clean and decontaminate the final product before dispatching it to the clinic where the patient will be waiting.